Hello, today we're going to talk about biomedical therapies. Oftentimes, when clients receive help for various psychological disorders, like, say, major depressive disorder, for example, they might receive psychotherapy and medication in combination. And sometimes other types of biomedical therapies might be used. Sometimes patients only receive biomedical therapy, sometimes only psychological therapy, and oftentimes a combination of the two. So there are three kinds of biomedical therapies that we'll be taking a look at. Drug therapies, by far the most common, brain stimulation, and psychosurgery, which is rarely practiced today but still has some uses. All drugs that are used to treat psychological disorders exert their effect by um, influencing neurotransmitter activity in one way or another. Whereas other types of biomedical therapy may affect the electrical conductivity of the brain, or even the structural functioning of the brain, depending upon what particular biomedical therapy is being used. Drugs are used more than any other biomedical therapy, and oftentimes to determine if a drug is effective, it'll be tested using a double-blind technique where half of the patients get the drug, the other half get a placebo, and the researcher is looking to see if the drug produces the desired effect. In such studies, they are typically double-blind, where neither the staff nor the patients know who gets which one. How about this for a review question? In a drug study looking at the effects of a new drug on depression, what would be the independent variable and what would be the dependent variable? If you said drug for the independent variable, you are right. And if you said depression for the dependent variable, right again. So these are the different categories of drugs that are used to treat psychological disorders. Their name pretty much gives them away as to what types of disorders they are used to treat. Antipsychotic drugs, anti-anxiety drugs, antidepressant drugs, and mood stabilizing drugs. If you recall, when we were talking about schizophrenia, a psychotic disorder, we said that one of the hypotheses about what causes schizophrenia is an overabundance of dopamine activity in the person's brain, and that seems to be related to an overabundance of dopamine receptor sites. So antipsychotic drugs exert their effect by actually blocking the dopamine receptor sites so that the dopamine cannot stimulate the neuron, thereby resulting in a decrease in activity of dopamine neurons and a corresponding improvement in positive symptoms primarily of schizophrenia. Anti-anxiety drugs, many of them influence the brain by activating GABA neurons in the brain. An example of an anti-anxiety drug might be a drug like Xanax or Ativan. So GABA neurons are neurons that, when they are stimulated, they have a relaxing effect on the central nervous system. They are inhibitory neurons, in other words. So the drug itself will bind with GABA receptor sites, activating GABA neurons, and then causing a relaxing effect on the nervous system. Antidepressant drugs, on the other hand, sometimes referred to as selective serotonin reuptake inhibitors or selective norepinephrine reuptake inhibitors. And some combine the two, both serotonin and norepinephrine. They block the reuptake of serotonin and norepinephrine at the synaptic junction, thereby allowing for higher levels of serotonin and norepinephrine to remain in the synaptic spaces of the brain, and thereby stimulating neurons, which has the effect of eventually helping to improve mood in people who are depressed. And then mood stabilizing medications are used to treat bipolar disorder. Their mechanism is less clearly understood, and all of these mechanisms that we're describing are just some of the ideas about how the drugs work. Scientists, researchers are figuring out new aspects of how to treat psychological disorders and medication in an ongoing way. So these are some of the ideas. A commonly known mood stabilizing medication, and by far not the only one, but one that's probably been around the longest, is lithium in the form of a salt, lithium carbonate. You may see ads on TV for various drugs to treat psychological disorders. It's a pretty booming business with new drugs coming out all the time. So how do researchers evaluate the effectiveness of particular drug therapies? By conducting double-blind experiments. The drugs given most often to treat depression are called, let's see if we can figure that one out, antidepressant drugs. Schizophrenia is often treated with antipsychotic drugs. Very good. Electroconvulsive shock therapy, also called ECT, has been around for a long time. In the early days, in the mid 20th century, when it was practiced, it was rather barbaric the way it was done, because the person was just sort of held down, their brain was shocked, and they would go into convulsions. They did find that these treatments did improve psychological symptoms, especially severe symptoms of depression. But the way the procedure was used initially, it had quite a negative effect on the person's body, because their body would jerk violently. They might fracture their jaw or vertebrae in their spine because of all the jerking around that was going on. They had really bad headaches and memory loss. It was just a rough treatment to go through. Nowadays, when electroconvulsive shock therapy is conducted, it's much more humane. It is still used primarily with patients who haven't responded well to other treatment approaches for severe depression. Now, when a person receives ECT, they are anesthetized. They also take a medication that keeps their muscles from jerking, a neuromuscular blocker. They're carefully monitored medically, and they only receive a very slight dosage of shock for a second or so, or even less. And it can be administered to one hemisphere or both hemispheres. So it's much more precise the way it's done now than how it was done in the past. And it has been found to be helpful. In the treatment of severe depression, nobody knows exactly how it works. They have various ideas about it, but it's still a treatment that's used. And typically you go in the hospital, you receive several treatments in the hospital, and then after discharge, you'll receive some follow-up treatments with ECT as well. And it has been found to be helpful in reducing depression and also suicidal thoughts that often go along with depression. Here we can see a diagram showing a modern patient receiving ECT, where you can see various vital functions are being closely monitored while the person is receiving the ECT treatment. Two other interesting treatments that are used, especially in the treatment of depression, that affect electrical conductivity in the brain are magnetic stimulation and deep brain stimulation. In magnetic stimulation, called repetitive transcranial magnetic stimulation, the person has a large magnet that delivers a pulse, an electrical pulse through their brain. It does not cause convulsions like ECT. It's much easier on the body than ECT. Now, electroconvulsive shock therapy, ECT, will produce some memory loss for events around the time the ECT treatment is delivered, but reportedly, transcranial magnetic stimulation does not produce memory loss or other side effects. So it's still somewhat of a controversial treatment, but available, and there are centers around the country that are using this treatment. Here we can see a person who's actually receiving electromagnetic stimulation treatment. Deep brain stimulation is another interesting treatment approach that's used. Electrodes are inserted deep into the brain in certain areas that are thought to be associated with depression, and the person has a battery pack that's placed surgically underneath their skin, say in the chest area, and they can activate the battery pack to send pulses of electricity to a particular area of the brain to stimulate it. And we won't get into all of the technical aspects of that particular treatment, but we can say that it has been found to be helpful in the treatment of depression in particular, especially when those electrodes are placed in a particular area in the frontal lobe of the brain that has been found to be associated with depression, and that area is stimulated. In the way of review, severe depression that has not responded to other therapy may be treated with ECT, which can cause memory loss, and more moderate neurostimulation techniques designed to help alleviate depression include deep brain stimulation and electromagnetic stimulation. Very good. Psychosurgery. Back in the 40s or so, a lot of psychosurgery was being performed on severely disturbed psychiatric patients. It actually started in Italy, I believe. And the surgery was performed in the form of what's called a lobotomy, where nerves connecting the frontal lobes to the emotion controlling centers of the inner brain were cut, severed. When this happened, people became permanently listless, immature, and uncreative. It was a really terrible treatment that left people in a significantly altered state where basically they just lost their personalities. Heartbreaking. But at the time, people thought it was the thing to do. So a lot of patients ended up receiving that treatment. President Kennedy's sister, Rosemary, the woman in the middle here, you can see President Kennedy when he was a young boy on the side, and his other sister, Jean, there. Rosemary had significant psychiatric problems, and her father agreed for her to have a lobotomy, and it had disastrous effects on her, requiring her to remain institutionalized the rest of her life. And nowadays, a very refined type of psychosurgery is sometimes still performed in the treatment of some disorders. Severe OCD is one that comes to mind, where the techniques are used to go to very, very precise areas of the brain and surgically ablate or remove them, and using magnetic resonant imaging to guide the precision of the surgery. That completes our discussion of biomedical therapies, and that completes our series of discussions on therapy. Thank you, and God bless you. Peace be with you.